Okay, so we're live. Let me make sure that the video is showing up so I can share it out. Okay, yes. So I'm showing, let me, okay, so we're live, guys. Happy, what day is it today? Tuesday. Happy Tuesday, everyone. So we are back again with a Black Business Highlight where we are spotlighting local Black women-owned businesses across the Valley. So today we are with Ejiro. We're going to be talking to her today, learning a little bit about her and her business. This is going to be a good one, guys. So if you have any questions while we're on here, make sure to put them in the comment section below. I'm also going to be putting her website if you want to check that out after our live as well. So we're going to start with introduction. So my name is Faye. I'm the CEO and founder of the Black Women of Arizona group. And so today we're going to be talking to Ejiro. I'm going to go ahead and give it over to you. Tell us about who you are, where you're from, and um, what journey or uh what is your why basically for starting Modernized Wellness?
All right, excellent. Thank you. So my name is Ejiro Ojameruaye. I'm a nurse practitioner practicing here in Phoenix, Arizona. I am pretty much a native, like I was discussing with Faye earlier. I was born in Nigeria. My family moved out here when I was age 10, and I've lived in Arizona most of my life. So I consider myself a native. I went to Arizona State University, Grand Canyon University for my education. My journey and why to my practice is I've been in the healthcare field since I was age 16, starting as a nursing assistant, worked my way up to a nurse practitioner, and I've worked in so many areas in healthcare. I've seen what chronic illnesses does to people and how these patients remain in the system dealing with chronic illnesses. And so my goal as a nurse practitioner is to come in and see ways that I can help my patients take control of their lives before chronic illnesses start to creep in. So some of the services I provide in my practice usually will help target patients at an early stage to help prevent things like chronic illnesses that come from like obesity, diabetes, kidney issues, taking care of your health ahead of time. So when you get to that age, you're not dealing with chronic illnesses. Things like IV therapy, which has been up and coming, like with the IV hydration infusion clinics. People go to the hospital for simple things as dehydration. To be able to provide that in my office where you don't have to go to the hospital is another service that I love to provide to patients here at my practice.
Okay, perfect. All right, so we're going to dive into some of the services that you offer. I know a lot of them are gaining some popularity, but for people like myself and other people in the community that aren't really educated on the benefits, we're going to be going through a few of the services that you offer, the benefits, and who the ideal client for those services would be. So, talk to me about maybe one of your most popular services first, and then we can kind of go over the other services as well.
Okay, great. So majority of my services is to help optimize patients' health. So the population of patients I get are not your chronically ill patients. These are people who are doing pretty well. You know, labs look good, but I'm still having some fatigue. I feel like there are other things I could do to be better. Or I'm an athlete. I want to improve my performance. So it's mostly majority healthy patients in the mid 20s to about 60s that I typically would see. One of my popular services would be the IV therapy because, you know, we kind of talk quickly on that. IV therapy is becoming very popular. People know it as IV hydration, IV vitamins. with COVID, this has picked up because people have seen the benefits of not only vitamin C taken orally, but in the vein. Now, in the vein is IV. That's what it stands for. When you give vitamins and medicines through the vein, it hits your system immediately. That is the benefit. Whereas if you take medicines through the mouth, you have to bypass different organs like your stomach, and you may not absorb everything completely. So IV therapy has been shown. We use it all the time in hospitals. It's not new. It's been around, but just having it access to it outside of the hospital has been game changing. People who had COVID and were suffering with a lot of symptoms for days, I would have them come in, we'll do a high dose of vitamin C, which you cannot take orally because your stomach cannot handle those doses. But I would hook them up within 24 hours. They're back to feeling better. The cough, the fever, whatever it is, has come down, and they're back to functioning like they were. So besides just the cold and flu symptoms or COVID symptoms that patients see relief, there are things like patients who are on chemotherapy and radiation for cancers. There are studies that have been shown where high dose of IV vitamin C has helped keep those cancer cells down. I have patients like that who will come in for chronic illnesses, and I would treat them with IV therapy. So not just their boutique hangover clinics, like hangover cures, but I do other chronic illnesses treated with IV therapy. Um, in addition to the IV therapy, there are things that I do in my practice where everything kind of works together. We'll talk about it later, but peptide therapy is the one thing that I also try as well too, depending on what my patient is going through. So if they're coming to see me because they have some fatigue for like an autoimmune chronic fatigue syndrome, we talk about other things like peptides after I do a good full workup with them and see how, again, I can help optimize their health using several modalities.
Okay. Okay, good. So before we get into peptide therapy, I want to ask you, in regards to IV therapy, um, I know you've kind of already went over like the benefits and stuff like that, but for someone who might not be, um, you know, suffering with COVID or have any like a flu or anything like that, who might not necessarily need like a high dosage of vitamin C or anything, how often do you recommend IV therapy just on a general basis? I know it's going to be different for everyone,
Yeah.
but how often would you recommend it as a professional?
So, as a professional, what I strongly recommend when I have patients call me for IV therapy is a consultation. So, a full lookup on your history. I get some basic labs, or if they've had labs done by their primary care, we look over it too. We can go as detailed as looking at nutrients in their system and seeing where they're deficient, so I can replace that with IV therapy. So, it's very individualized. If you're just coming because you maybe have occasional migraines,
Mm-hmm.
you may just need a trip maybe once a month, twice a month. If you're coming because you're someone who's chronically dehydrated, you drink as much as you can, but you still cannot, rehydrate once a week, twice a week. It depends on what your labs are showing me, what your history is, how your kidneys look. So I look really at the individuals and come up with a plan based on how often I think they should benefit from the IV therapy. For those who maybe just had a lot of drinking over the weekend and just need that hangover cure to get back to work on Monday, just once in a while, you come in, I hook you up with some fluids, I put some vitamin Bs in there. You don't even need the vitamin C, honestly, for those kind of patients. You just need a lot of B vitamins at that with those patients. So a quick bag of that, give you some anti-nausea medicine, you're back to feeling well to go back to work the next day. So it really depends on what the individual symptoms are and what we're trying to achieve.
Okay. Okay, good. Now I want to ask you this because it just popped up while you were going over that. So I think the general knowledge is that we know vitamin C is good for your immunity, your immune system. What are the benefits of vitamin B in layman terms?
Yeah, so B for energy production, mostly. So for a lot of patients who are having fatigue, you see them taking the B12. That will help boost your energy. Um, we should get those vitamins normally from foods that we eat. However, your diet, your nutrition, depending on the individual, you may not be getting those vitamins and nutrients like you would. So supplementation helps. And you don't necessarily have to supplement with IV. There are B vitamins over the counter that you can take. So I do carry a stock of vitamins in my office, and I have an online dispensary on my link tree. I always stress that patients get pharmacy grade supplements, because you could go to Walmart and just pick something off the shelf. If you look in details on the back of it, you may just be taking a bunch of fillers and things that you don't really need. The active ingredient, which would be vitamin B6, B3, whatever it is, has to be what you're taking. And some of those supplements don't have it. So when I send patients home with supplements, I usually have them purchase it from the resources, like from the pharmaceutical supplement stores that I recommend, basically.
Okay, and thank you for sharing that, because I think that a lot of people aren't aware. Like, for people who are getting more serious about just being healthy in general, they may go to Walmart or Walgreens and just pick up, the cheapest
So
vitamin that they see on there, and a lot of them include extra stuff that we might not actually need.
yeah.
So I know that you have your own supplements that you provide to your clients and stuff like that. But for anyone who is still kind of on the fence as far as coming to you for services, do you have any advice as far as what they should look for if they decide to go to their local Walmart or the local drugstore to pick up any supplements?
So I don't have my own personal supplements. I do have companies that I get supplements from.
Hmm.
So supplements in the United States are not regulated. Anybody could pretty much just open a supplement company and just start selling it. And they can tell you this is what it is, but it's really not what it is, or it may
Hmm.
have just a little bit of what it is that it says it does, right? So the companies that take the extra step of doing research and having someone test, those are the companies that I usually would go for, because they have the labels that show that we spent extra money to guarantee that you're getting vitamin C and it's 100% vitamin C. Other companies, it may be like 20% vitamin C and other things. So what I have patients do is bring their supplements in that they're currently on, and I have one from one of the companies I use, and we compare it side to side, the active ingredients and the inactive ingredients. So if you wanted to know on your own, you look on the back of the label and see where it says active and inactive ingredients. If there are a bunch of things that you can't even pronounce, I mean, you could Google it on the internet and see
Hmm.
what those things mean. But if there are a bunch of things that, are just fillers and things that are not necessary, why ingest those things?
Right.
So I'm able to show you side by side with the company that I utilize versus the one that you're just picking off the shelf. Mind you, there are vitamins that are off the shelf, like Garden of Life at Sprout,
Hmm.
which is a good brand actually. So if they already get that, I just tell them stick with that. That's a good one. But if they're not sure, I would share what recommendations I have. There are tons of other companies that are reputable that I usually refer patients. And if you go on my Instagram, I have now included the specific links for some of my for what to purchase your supplements. So you have several options as far as price. The price varies based on the company, but you're getting it from companies that are reputable.
Okay. Okay. Good. So I'm going to put your um, Instagram page in the link here. Is it Modernized Wellness Clinic on Instagram as well?
It's Modernized Wellness on Instagram, and it's
Okay.
yeah.
Okay. So I just want to make sure I put that on there in case anybody wants to check it out. So let's get into peptide therapy. I know we were talking about it a little bit before we actually went live. And I know for me, I've seen it in some skincare products that I've seen over the shelf. I haven't really looked into them. So talk to me a little bit about what peptide therapy is, who is it good for, and what are the benefits?
All right. So Peptides are like protein. It gets really hard to explain it to people who don't understand it. So I try to break it down to in layman's terms. They're like protein. They're protein chains. They're just shorter. They're put together
Mm-hmm.
by what's called peptide bonds. And so when I do peptides with my patients, what they're doing is they could act like hormones in the system, or they could signal major organs in the system to help function and get better. So, how is peptide applied to my patients? There are different types of peptides. Let me use
Mm-hmm.
insulin. Everybody knows insulin. When you're a diabetic, you get insulin, right? Insulin
Mm-hmm.
is a peptide. It's signaling your pancreas to release insulin, do what it's supposed to do for diabetics. Another example I gave you earlier is a new weight loss medicine called semaglutide for losing weight. It is a peptide. It's signaling your stomach to remain full and to, you know, suppress your appetite to help lose weight. So with peptides, the most application that we usually see it is in cosmetics. So when you go for a higher quality cosmetic products, they usually will use the word peptides. And what that means is it has the factors to help improve collagen production in the face, give you more of a finer, smoother texture on the face, reduce fine lines. Um, Peptides also is being utilized for muscle builders, like a lot of the athletes with recovery, muscle building. I utilize peptides for that. Beyond that, I also use peptides for sleep. So patients who have issues with sleeping and they've tried like melatonin or whatever it is they've taken to help them sleep with no results. I again do my consultation with them and get the story behind their sleep problem. Why they having sleep problems? Is this something that they need to go to a doctor and do other sort of workups? Once I rule those out, we talk about what options do they have. If they fit the criteria for a peptide, there are several peptides that I can utilize for sleeping. And peptides come in different forms. Majority of them are injections. So
Mm-hmm.
if it's an injection, it could be once a week injection, once a day or twice a day injection. So those are the things that we talk about. There's peptides for sexual function. So for those who are having, who have tried things like Viagra in the past with no success, or even women, there's nothing like Viagra for women right now. But I
Mm-hmm.
do have a peptide that has been FDA approved actually for sexual function in women. And so those are things I let patients know about. The biggest part of peptide I use is for weight loss. Like I talked briefly about semaglutide. Semaglutide is just one tool in the box. There's several other peptides that I utilize in my patients who are struggling with weight. And again, with my weight loss, I get a history. I do a one-on-one consultation. We talk about what it is that has caused the weight to come. How long does it taken? And we talk about what the options are. And based on what their lab is, my history, their physical examination, I would recommend maybe a medication, a dietary change, exercising in addition to peptides. So peptides are not just the one, here, let's do this. There are other things that I do in addition. Peptides just adds on there to help optimize things for my patients, if that makes sense.
Okay. Yeah, that was a very detailed breakdown. So um it sounds like there's a lot of different benefits of peptide therapy, no matter where you are, whether it's for weight loss or sleep and fatigue or diabetes and things like that. So um thank you for that. The other service that I noticed that was listed on your website was, I guess, more towards skincare or cosmetics. So I want us to talk about Botox and
Mhm.
fillers. So
Yeah.
I know it's two different things, and there's a lot of misconceptions out there when it comes to both. So I want to first start with Botox. What is it? What are the benefits? And what are some common misconceptions that you've come across when interacting with people in our community that we can kind of use this time to educate them on?
Yeah. So aesthetics definitely is something that I've rolled into my practice here in the last year. Botox is one that's common. You say Botox, everybody knows Botox everywhere. Botox is actually a brand name.
Mm-hmm.
Neurotoxins are what they are. And what neurotoxins do is they help relax the muscles Mostly commonly used in the face, around the forehead, in between the eyebrows, here around the eyes, sometimes around the lower part of the face, even the muscles right about here. Botox is used to help relax those muscles, to help reduce wrinkles and fine lines. Lasts about 3 months to 6 months, depending on the individual and how much you use those muscles. Um, like I said, Botox is a brand name. There are other brands like this Sport and Xeomin. I actually have the little boxes here. I don't know if it's easy to see. That is
Mm-hmm.
a Neurotox, but that is a brand name, this Sport. And you have one that I commonly love to use called Xeomin. They're all brand names,
Mm-hmm.
and all they all do the same thing. Um, the Xeomin just has less ingredients. It's more pure. So I have patients who are like, "Oh, I don't know. I've tried Botox before and it didn't work for me." Xeomin is one I usually would recommend for patients because you don't build a tolerance to it. So all it does is help relax the muscles to reduce frown lines. So if you're one that, when you frown, you have those lines in between your forehead. What Botox is going to do, the neurotoxins, is just going to help relax that muscle right there, so you don't have much of that line right there. Because over time, what happens with lines around the forehead here, they get arched into the skin,
Mm-hmm.
and then it gets really hard for you to fix that with neurotox. At that point, you would have to do lasers and do other very extensive procedures. So I was talking with Faye earlier, and she asked the question, how soon do you start doing things like Botox and neurotox? I always say in your 20s. It's never too early. When you start noticing any small fine lines, you can start doing it. Then you do less. You don't
Mm-hmm.
have to come in every 3 months. You can do it once or twice a year. And you use good skincare products. You use things like a chemical peel once or twice a year. Those things will help reduce those fine lines. So as you age and you start getting into the 50s and 60s, you don't have those indented marks on your face, and you are still looking pretty good at those age because you started early on. Now with fillers are a little bit different. Fillers are like sugary substance. They're a little bit thicker. And
Mm-hmm.
those are injected to fill in like more grooves, like around here where we call the nasolabial fold lines. This
Mm-hmm.
Botox does not take care of this. This is where you use things like fillers. Under the eye, where we have a lot of the hollowness over time, fillers would go in there and help plump those areas so you have more fullness. When you get older, some people, they lose a lot of this fat pads around their faces. That's where we use fillers to help plump things up so you have more of a lift. So that's the difference between a filler and Botox. Botox, neurotox. I say Botox, but really it's neurotox. I say Botox because people know Botox.
Mm-hmm.
But neurotoxins, what they do, they're really very safe. Almost no side effects. Like I
Mm-hmm.
explained with you, I can do this at your home easily. With fillers, there are a little bit of side effects, not side effects, but there could be complications. So I usually would do them in my office here and monitor my patients very closely with that, because you have major arteries and veins that go in the lips, around the facial areas. And so when you're injecting or you're having an injector inject, make sure it's someone that has been educated, they know the anatomy of the face, they know what they're doing. That's very important, because you just don't want anybody injecting anything in your lips. I've seen little clinics with offering lip injections that they're not providers. And, I try to educate as much as I can and say, hey, if this fillers get into arteries in your lips, uh, you could lose your lip from that.
Mm-hmm.
So education and, you know, going to a practitioner that knows what they're doing is very important.
Right. And I thank you so much for bringing that point up, because I've seen quite a bit of people offering these types of services, and then I've seen the horror stories that go along with them. And
Yeah.
one of the reasons why I'm so excited you are on here with us today is because we need more people that look like us in these types of spaces, right?
Yeah.
Because, I'm not an expert, and so correct me if I'm wrong, but we have different, our features are a little bit different than people that are outside of our community. So if we're
Absolutely.
going to put to places that don't understand our specific anatomy, I'm not saying it'll happen, but you run the risk of those things happening. So it's very important, not only just to support local Black women owned businesses, but the professionalism of it, going to someone with the experience with working with people like us, so that way when we come out of the clinic, it doesn't look like we came out of the clinic, right?
That's important. You know, how many times I'm out in these groups and I see people looking for a black doctor, black
Hmm.
pediatrician, you know. So my goal here is to let them know it's not just myself. I know some other wonderful African American doctors in this field of what we'll call probably alternative medicine, cellular medicine. Um, we're here, and so if you're one of us in this field where you feel more comfortable, definitely I'll share those information as well if you don't even want to come to me. But we're
Hmm.
here for our community. There's, like you talked about a little bit, the misconception in our community with Botox and fillers. We don't feel like we need it. Uh,
Hmm.
Black don't crack, so
Right, right.
we don't need that. But there's a reason why people like Angela Bassett and all these celebrities look good, because they're doing these things, you know.
Hmm.
Yes, we're not looking like, we talked a little bit about the frozen look, like when you get
Hmm.
Botox and you can't smile, you can express yourself. That's not always the same all the time. Like I gave the example of Xeomin, one of the peptide neurotoxin I use. I'm sorry. That's one that gives you a softer look where you can still move your face, but it relaxes the muscles. So that's where education and knowledge comes in. I'm able to let you know that what picture of Botox you see in the past is not what you're going to get. This is what you can achieve, you know, based on the options that I have. So black can crack if you don't take care of your skin. So I
Right.
do education on the type of skincare products you should be using, not just anything. Like I strongly recommend pharmaceutical grade not supplements, but pharmaceutical grade skincare products. They're a little bit pricey, but in the long run, it's going to help you a whole lot in keeping your skin integrity and helping um, keep that youthfulness of your skin.
Right. So thank you for bringing that up, because that was going to be my question, as far as some misconceptions that I've had when it comes to Botox, as far as like getting that frozen look or having to wait until you see the wrinkles and you see the lines to actually get started.
Yeah.
Um, so thank you for that. So the next question that I want to ask you in regards to fillers. Um, and I guess this is a misconception that I had as well, because again, I'm not the expert in this field, right? So, one of the things that I've seen with when it comes to fillers is the overly
Overfilling.
like puffy face. The
Hmm.
lips look kind of weird.
Yeah.
And I understand that it just depends on how that person, the look that that specific person is going for.
Yeah.
But talk to me about some of the misconceptions in regards to fillers, because I feel like as Black women or Black people in general, we don't feel like we need those things, because we already have full lips. We have, different features. So talk to me
Mhm.
a little bit about that.
So you definitely hit the nail right there. We already have full lips. Like if you look at the other races of lips, they are proportion of the upper lip to the lower lip is way different for ours. We have fuller lips where it's the same volume. So a lot of them are trying to achieve, I don't want to say what we have, but close to what we have. So when you have African American client that comes in and says, "Well, I want lip injections," and what are you trying to achieve? So it's
Mhm.
not necessarily about being really full and having fuller lips. There are things like plumping your lips up. Some patients have really dry lips or have a lot of lines in the lips. So what we can do with fillers is to fill those up, give you more hydration to your lips. I even have a filler that gives you a little bit of pink hue to your lips as well too. So it depends on what we're using. And there are different types of fillers too, and they have different consistency. So if you're not one to have the really big pronounced lips that we see in some of the celebrities that overdo it. I can do lip injections that nobody could even tell. I mean, you would look and you could have more of the like the angles of the lips if that's what you're trying to achieve, just to have the edges, the borders filled, things like that we can do to get you looking naturally as possible without looking overfilled. As far as the cheeks and how sometimes they look overdone with that.
Mhm.
Again, it depends on the individual. What are you trying to get at? a proper assessment is very important. So a before and after picture, you take a picture first. This is what you look like. If you add about a couple of cc's here, this is how it's going to lift. And, just try to explain that with patients so they can see. If you already have a full round face, you may not need a filler. So this is where education comes. It may have your face look bigger, So there are things like, I don't offer it, but it's called PDO threads, like other modalities that can be done to help pull the skin up rather than doing fillers. I also do something called PRP, which is platelet-rich plasma. And this is actually nice for a lot of people who want to stay away from artificial stuff. I don't want to put nothing in my body, that could be a misconception as well. So I want to do something natural. PRP is actually very great. I love it. So what I do with PRP, platelet-rich plasma, is I draw my patient's blood and I have a centrifuge. I spin it down and I take the blood cells separate. And what you have on top is your platelets and your plasma, which are your rich part of your blood. Those have healing growth factor properties. So I take that. I can use a needle inject right underneath the eye. So what it does is it stimulates collagen and it helps plump up this. So if you're one that doesn't want fillers, but you want something natural, I strongly recommend that PRP. What I also do with PRP with the platelets is I use a microneedling device to make passes around the skin, causing a little bit of injury, and then apply that platelets on your skin. And so what it does is it helps heal give you fresh baby skin. If you're one that has melasma, hyperpigmentation, it clears up your skin. And you see those results within about 2 to 3 months after several treatments once a month.
Okay.
But yeah. So those are other options that are also available for non-filler Botox customers.
Okay. I want to ask you before we move on from the fillers, because I know you said for the PRP, it could be, you said once a month?
Yeah, once a month.
Okay.
So once a month is what I recommend. And you probably would do like a once a month for 3 to 4 months. You start seeing results around 2 to 3 because it takes several days for that skin to turn, about 30 days or so. Once you do those 4 treatments, then I would recommend once a year, twice a year, depending on how your skin is looking. PRP now can be used for hair loss as well, too. If you Google on the internet, you will see PRP being used for hair loss. So again, it has growth factors in it. So what I do is that same plasma platelet that I've taken from the blood that's separated, I go ahead and inject it around areas. For a lot of us who have traction hair loss from braiding, we have the hairlines, I can go ahead and inject around the hairline to help stimulate that hair to grow. If you're one that doesn't have any hair follicle, you have like really severe hair damage, like PRP may not be best for you, but if you still have a little bit of hair growing, you may see great results from getting PRP injections around your hair. The same once a month for 4 months, and then maintenance afterwards of once every 6 months or so.
Okay, that's good. I literally never knew that.
Yeah.
So that's very good because I have a little situation going on here.
A lot of us do.
So let me ask you, because I know you said if it's more severe, that it might not be a good option for that. So would something like someone who's suffering from like alopecia, would this be good for them as well, or no?
They may not benefit from it, honestly. There, I would recommend going to a dermatologist and getting a proper history with a dermatologist and seeing what other things that they do for treatment of alopecia, because I don't treat specifically alopecia. And once they start having some hair coming back, they can come back to me and we could try PRP to help make it come out faster or just have more evenness and hair grow everywhere. So I can work with your dermatologist, and be honest with you, most dermatologists do PRP as well too. So they'll tell you if you're coming for treatment of alopecia, let's add this here. They do laser treatments as well. I think with the cap on the head, and also there's some topicals that can be used as well for hair loss. So I usually would not treat patients with really bad like alopecia. With very traction hair loss. A lot of men who are losing hair from like taking a medication called finasteride, things like that. Those are most of the patients I see and treat with hair loss.
Okay. All right. Perfect. So the last question that I have about the fillers, because I know you said We went over how often the Botox should be done. We went over how often the PRP should be done. What about fillers? Does that just depend on where they get it on their face, or what is a general time frame?
So most fillers anywhere from 6 months to a year. Some people have fillers that last them up to 2 years. There are different types of fillers, like I said. There's some longer acting that will last up to 8 to 2 years. But 6 months is usually the shortest duration. However, there are very exception people who would burn through their fillers. If you have high metabolisms, there are patients that I've seen who I just put a filler in their lip like a month or two ago, and they come back and you know they want another syringe. I usually tell you to wait out at least like 3 to 6 months, not to overdo it, so you don't get over full. But there's a few patients who have higher metabolisms and it kind of, I would say, eat through it. It wears off a little faster. But most individuals, about 6 months to a year for filler.
Okay.
Yeah.
All right, good. So we've talked about quite a few of your services, the benefits and things like that. So if anyone who's watching or going to be watching the replay, if they want to reach out to you for services, obviously you guys, her website and social media information is in the comment section below. But talk to me about the different plans that you have available for anyone who's interested in your services.
So right now, if you go on the website right away, you get a pop up. I do have a membership plan right now for I think it's $49 a month. I created that membership for my patients who just want to come in every so often for a hydration. Especially it started during the summer where it gets really hot, and so you're not suffering and you don't go to the ER to go get charged $1,000 or more dollars for a bag of fluid. It's $49. You come in, I hook you up. I have a lounge here in my office with a TV. Hook you up to a bag. If you want some vitamins, those are additional costs that I would add on there. But I just hook you up within 30 minutes to 45 minutes. You've got a bag of hydration that comes free with a membership of $49 a month. And whenever you want to utilize it, it's up to you. If this month you're feeling well, especially during the winter time, because you're not quite as dehydrated, there are things like a basic facial peel, which I do. You can utilize that instead of your IV drip. If you want to get a B12 shot because you're working out, or a fat burner injection, you can substitute that as well. You get 1 or 2, I believe, a month free with that membership plan. And also with the membership plan, you get discounts. I have a whole lot of discounts on my products when you're on the membership plan as well too.
Okay. All right. Perfect. So,
I forgot to talk about that.
Oh, weight loss. Go ahead. I'm sorry.
So no, this month I do have a membership for weight loss. Medical weight loss. I do monthly membership. I believe my consultation is about $200, and then it's $100 a month. That $100 covers your meal plans, like not meal plans, but dietary advice and monitoring, lab monitoring. Doesn't include the medication, because I do have a long list of options that I utilize for medical weight loss. Right now, I posted on a group earlier this month on the special I have. It's called semaglutide. I talked a little bit about it. I keep bringing it up because it's just been amazing. If you Google semaglutide, the Kardashians, everybody that you know is on it. Celebrities are on it because it's been shown to help lose a whole lot of weight. I currently started on it. I was nursing my son. I just stopped this month, and so I just started on it. I'm ready for my weight loss journey. I have several patients on it as well. It is very low side effects. It's one of the healthiest option, I would say, of weight loss medicine that I can provide to my patients, and I'm so excited about it. There are other things that are out there that just are very damaging to the heart that I try to tell patients not to use. I don't use them in my practice. This is something that has very little to no side effects and has been proven. The FDA has approved it. But if you don't meet the criteria for it, you're going to pay about $2,000 a month or more for it. So I'm able to get patients through sources that I have, a compounded pharmacy, at a cheaper price to really help our community, mostly because we suffer with things like obesity, hypertension. I mean, there's not a lot of us in this country, but when you look at a lot of the health chronic conditions, African Americans number one. We're the highest for high blood pressure, diabetes. and then you try to get things like this medicine, Ozempic, that's been approved by the FDA, and your doctor tells you, well, you don't meet the criteria. It's tough, and you need
Right.
to lose that weight because it helps reduce those chronic illnesses. It helps reduce, generations of chronic illnesses. So I really want to be able to offer this to my community and let them know that, hey, I can do this for you. We can help get you on your weight loss journey and change your life. So 20, 30 years from now, you're not having to deal with things like chronic kidney illnesses, hypertension, complications that come out of being overweight. So please, if there's anyone that you know struggling with weight, there are options that are safe and affordable out there. That's my biggest message here.
Right. So thank you so much for sharing that, because it's safe to say that we are aware that obesity is a problem in our community, and a lot of times it's not that people don't want to make those changes, but it becomes a issue of access, right? Of
Yes.
just being able to have access to those types of services, whether it's because it's not offered to you, you don't fit the criteria, or financial access is a really big
Don't
issue
even
in
know
our
about it. It's
community.
just like, when you go to some neighborhoods, there are no things like Whole Foods or Sprouts because you just don't know about it. But you come to other neighborhoods and there's Whole Food around it.
Right.
So it's just letting you know. That's why I want to try to be a voice so people know there are these options here that other people, other communities are utilizing. So you do have it available. So reach out. Unfortunately, I'm cash only business. I don't accept insurances at this time. So I do know cost could be an issue for some patients, but I really try as much to offer things like programs to help discount it so that doesn't deter people. I want to talk about a misconception about weight because you were talking about misconception.
Mm-hmm.
Weight is very individualized. People's weight history and weight gain history is very individualized. A lot of people say, well, you're fat because you don't work out. You just eat really bad. But that's not the truth. There's
Mm-hmm.
so many reasons people gain weight. There's so many things. This is where my consultation gets very important. I get a history and a story behind your weight gain. Things like stress. You'd be surprised how much stress can cause people to gain weight. I have patients who are like, I'm working out so much, I'm reducing my calorie intake, I'm still not losing weight. Sometimes actually over exercising could be causing you to gain weight. you know,
Right.
yeah, and people don't know that. So this is where the education becomes very big and the history collection becomes big. And we find out, well, you're doing the right things and you just need a little bit of help here and there. That's why I have so many tools in my toolbox. So it may not just be going to the gym, getting a personal trainer and eating salads. No,
Mm-hmm.
that might not work. So we look at your lifestyle, we look at the family. Family history is big.
Mm-hmm.
So we look at that as well too, genetics. Are you predisposed to these things? Doesn't mean that you're going to end up like this. You can start working on your health right now and fix it for your next generations as well. So the misconception about weight gain and weight problems, it's something that I try to educate my patients about. It's nothing that you're doing. If you're eating unhealthy, this is what we talk about. I don't do diet in my practice. We talk about
Mm-hmm.
healthy eating because these are lifestyle changes. These are things that you're going to be doing for the rest of your life. So you're not about to crash diet or do some sort of HCG diet or something for 2-3 weeks or a month just to lose 10 pounds. No, you're going to eat the same way you eat, but we're going to talk about maybe portion control,
Mm-hmm.
alternatives. Instead of doing this, let's do brown rice, this, that, like take away the whites. We talk
Mm-hmm.
about those things that you can change on, that you can sustain from now to 20 years, because that's going to be you.
Right.
Yeah.
Right.
So
I
those are the
think that's important. And I thank you for bringing that up, because I feel like sometimes when we're struggling with our weight, or just, it's a struggle to lose weight, I think some people think that they have to do these immediate drastic changes in order to meet their goal. So this is like, and I know I'm repeating myself, but this is why it's so important to go to people that look like you, go to people that are from the same community as us, because these are
like
the types of conversations you can have with those people that you might not be able to have with with people outside of our community, right? Because we understand the culture, we understand how we eat, right? So even if your food choices aren't the best, making those small little changes to eventually to get you to just go green, right? Or whatever that might be,
Absolutely.
instead of thinking like you have to, do everything cold turkey and just jump into this whole thing. Because just like you said, 20 or 30 years from now, it's not going to be sustainable, right? Because if you're used to eating this way and this is your lifestyle, and somebody tells you that you need to change everything about your lifestyle tomorrow, you might do it for a couple weeks, right?
And
But
you
it's not going to be it's not going to be as sustainable as if you make those small changes along the way. Because another thing when it comes to, and correct me if I'm wrong, but another thing that I've seen when it comes to misconceptions about weight and weight loss is that people feel as though they I lost my train of thought. Sorry.
that's fine.
Um, they feel as though if they're not doing this by by a certain amount of time, that they're failing at it. But everyone's journey is going to be different,
Very,
right?
yeah, very different. The same way everybody's journey is different on how they got to where they are. So that's why I
Right.
look at those things and see, you can't be overweight for 20 years and then expect to lose all those weight in like a month. Let's be realistic. It took you 20 years to get there. So that's where I
Right.
have the conversations with patients. So it's going to be gradual, but you're going to get there. That's where the lifestyle changes come. A sweet girl I started on my weight loss program about 2 weeks ago. She comes in telling me, I want to do intermittent fasting. I've heard about this. I told her, I said, well, don't worry about that. We're
Mhm.
not doing any of that right now. I just want you to cook your foods at
Mhm.
home for this month. Every day.
Mhm.
Everything you put in your mouth is your home cooked food. I don't care if it's burger, fries, whatever it is that you like to eat, just make it at home. And she was surprised when I said this to her. I said, watch,
Mhm.
I just want you to do that. If you have to miss one or two, don't overdo it. Just one or two a week. You can eat out. And when you eat out, just be careful what you eat out. But I want you to work on cooking your food. Cooking your own food at home, you'd be surprised how much of a difference. She's already lost like 10 pounds.
Oh wow.
Yes. But I mean, I have other things that I have her
Mhm.
on, but she's been cooking her food every day. I've told her she works from home. You have no excuse. Go cook. If
Mhm.
you don't have kids, cook your own food at home. You get to control things like oils and fats that's in the food. Now, when you start cooking your food at home, the next month we talk about what are you cooking and have her take a picture of the foods that she's eating.
Mhm.
What are you adding? Just to make sure that they have an understanding of how to cook properly, the right things to add in your food. Again, it's not heating up frozen food in the freezer. This is like fresh food. You're going to the store, you're buying
Mhm.
vegetables, you're buying proteins, grains, and you're cooking it yourself. Go on YouTube. There's tutorial videos on how to cook things. Find something that you like and learn how to cook it for yourself. So that's usually realistic things that I discuss with my patients to help them. I don't want people to start and then get overwhelmed from intermittent fasting. Oh, I can't do it, and then binge eat the next week.
Right.
I want that. And then next month, what we talk about, you like to go out to brunch? Yeah, you can go to brunch, but rather than go to brunch every weekend, let's treat yourself to brunch once a month.
Right.
And when you go, don't make sure you don't overeat to negate everything that you did for the week. So so those are the things that the kind of education I do coaching. I follow up my patients every week. You get sick of me texting you. I will text you and follow up with you every week, encourage you. I can link you up with one of my other clients who is the weight loss program. So you have a support team that you can talk with and someone that can encourage you. Sometimes, some people need a little bit of encouragement. I talk to family members to say, hey, let's join and help your family member get to the goal that they need. Because everybody's going to benefit from this. Everybody.
Right. Right. And it's definitely a team effort. And
It is.
so one of the things when we talk about the importance of uh, having a provider that looks like us is one of the, well, to backtrack a little bit, one of the things that I see is because there's a lot of different trends going on, right? A lot of viral trends, and people pick up on it, and I'm gonna do this and I'm gonna lose all of this weight. But sometimes there's no shortcuts, right? And
No.
so sometimes instead of, for the people who are like, well, I don't need to go to a provider to help me lose weight or to get vitamin C and do all of these things, I can just Google it on my own.
Yeah.
But sometimes Google isn't enough, right? Because
No.
I've had this
A
conversation
lot
with
of
people
information is
before.
probably not even correct on Google.
Right. So we can't really validate if the information for accuracy, right? We don't know if the information that we're viewing actually fits us in where we are in our stage of health, right? But then also, even if it the information does align with your lifestyle and who you are as a person, do you really understand how to implement those changes? And so I'm here to tell you guys, because I know this is another misconception when it comes to just overall health in our community. A lot of people feel like they could just do it on their own, but you're worth investing into your health, right? Health is like, without health you can't be the boss babe, you can't be the best partner, you can't be the best uh mom, right? So health is at the core of all of those things. So I encourage you guys today, even if you don't reach out to her for a consultation, reach out to her to see how she can support you. If you have any additional questions, reach out and ask, right? We always say we need more people. The people are here, we have to support them to keep them here, right?
So,
So make sure that you reach out to her to show her support. I did find your office address. So I did put that in the comment section below if anyone is interested in coming in. But you are appointment only, right?
yeah, I go by appointments. Although I'm here physically, I try to be here Monday to Friday. Um,
Mm-hmm.
just because I'm a solo practitioner, I'm the only one here. If I'm with a client, I try to make sure that so you're not sitting waiting. I do have a waiting area here, and I have several rooms. But appointments is always greatly appreciated. If you're in a neighborhood, I'm in here. You want to stop by? I don't have a client. Sure, I can say hello. We can chat. But appointments only is definitely appreciated.
Okay. All right. Perfect. So we've talked about a lot today, and I feel so much better because I've learned so much just by you coming on here and just talking about the services and benefits and things like that. Do you have anything in closing that you want to share with anyone watching or anyone that's going to be watching the replay?
Um, I've talked a lot, and I think part of just letting clients know is the education, the amount of education I've gotten so far, and I keep getting. This month, next week, I do have like a peptide conference that I'm going to be spending a whole weekend doing. I invest a lot in education to learn. A lot of the services I provide patients with research articles to show um, the I'm sorry, I just ran. I just forgot what I was going to say. I have research articles to back up the modalities I'm utilizing in my practice.
Mm-hmm.
I have doctors that I talk with in a lot of around the United States that I consult with as well too, who are seeing the same good results in their practices as well too, and I'm reaching out to them if I have questions or concerns. So I'm learning a whole lot, and I'm learning newer things that I'm trying to bring in for my patients as well too. So I'm constantly learning for my patients. Uh,
Mm-hmm.
our community, I would love to have more people from our community taking advantage of the services. Like I said, the affordability could be a little bit challenging given this time with recession right now. But again, my goal is to help our community. So any way I can help out, I would definitely help out to help anybody that really needs it. Anyone who's ready to make this lifestyle change to be the healthiest they can. And I see that they're ready. I'm willing to work with them. In the future, hopefully I'm able to take insurances. That way it's more affordable for those that would love to utilize that. I do take HSA cards right now. So for those clients who do have those health savings account with their employers, that's something that you can utilize for any of my services here too. So it's like a treat to yourself.
Right, right. So thank you so much. So again, guys, make sure you check her out on her social media pages, her website. Reach out to her and schedule that consultation, guys. You know we have to get out of this mindset that we can do everything on our own. These professionals are here to help us. So let's tap into our resources and actually use them for what they're here for, right? So
Yeah.
thank you so much, Ejiro. Thank you so much for tuning in. I know we've been on here for a little bit longer than we were supposed to, but it was really good, really educational. So I really appreciate it. So I will see you guys next time when we highlight another business. So thank you
Were
so
there
much
any
again, guys.
questions at all?
I don't see
Okay.
any questions. No.
I'm not able to
Um,
see anything here, so.
yeah, I don't see any questions. If anyone has questions like on the replay, because I know some people were in and out, I'll be sure to tag you so you can catch those.
Excellent. Excellent. All
All
righty.
right. Thank you
Thank
so
you
much,
guys.
guys. Thank you, guys. Bye.
Bye bye.